So your doctor has diagnosed you with high function anxiety. So what does that mean? High function anxiety is not actually an official diagnosis. It is not included in the Diagnostic Statistical Manual of Mental Disorders, which is commonly used by mental health practitioners to diagnose and treat anxiety disorders. But more about the official diagnosis later. To understand what high function anxiety means, we should first talk about low function anxiety. Low function anxiety is when anxiety is so severe the patient may be unable to handle everyday responsibilities, maintain relationships, hold down a job, or in extreme cases, leave the house or even get out of bed. With high function anxiety, you are likely to be able to manage your everyday responsibilities, have relationships, hold down a job, and may be relatively successful in life. Your anxiety may not even be noticed by others. However, despite looking okay on the outside, on the inside you're experiencing a range of anxiety symptoms like trouble sleeping, restlessness, trouble concentrating, muscle tension, tiredness, sweating, headaches, stomach problems, racing heart and feeling lightheaded. You're likely to be constantly worrying or on edge. The actual DSM-5 recognized disorder that high-function anxiety is most commonly associated with is generalized anxiety disorder. But it could also be related to other anxiety disorders like social anxiety disorder, panic disorder, OCD, or illness anxiety disorder. So what causes high-function anxiety? The causes vary from person to person and may include a family history of anxiety disorders, stress or stressful life events, or problems stemming from childhood. Some very successful people have had high-function anxiety, and the stress of success may trigger or exacerbate the problem. There are a few challenges with high-function anxiety. Firstly, people with high-function anxiety are often reluctant to seek help, or even admit that they need it. Because they are relatively successful, they may see asking for help as failure, or feel some stigma associated with it. Secondly, trying to hide their anxiety and get through life despite it can be really exhausting and can lead to burnout or depression. When anxiety is not treated, it can get worse and can become more severe to the point it might be considered low-function anxiety. Of course, through the course of life, anxiety can fluctuate between low and high functioning and anything in between. The thing that gives anxiety disorders away is behaviours. The most common anxiety-related behaviours are avoidance and reassurance seeking. These behaviours are much more noticeable with low-function anxiety, but in high-function anxiety there is usually less avoidance and reassurance seeking may be more subtle. All anxiety behaviours are based on trying to protect yourself from what you fear, and these fears are driven by maladaptive beliefs. Doctors may prescribe a low-dose medication called SSRIs for high-function anxiety, but a better approach would be CBT because it has a very good chance of success. CBT teaches you how to identify and change the maladaptive beliefs that drive the anxiety, and although not easy, it does not have any side effects. A particularly powerful tool used in CBT is behavioural experiments. With behavioural experiments, instead of doing what you usually do, you try a different approach, even if you fear the outcome. Usually you find the outcome is not what you had feared, and this weakens the belief that was driving the anxiety. If you've had high function anxiety for a long time, your beliefs and behaviours will be deeply entrenched. So you may need to repeat the same and new experiments many times to change the maladaptive beliefs in the long term. You will also need to spot your avoidance and reassurance seeking behaviours, work out the underlying beliefs, and then challenge them with behavioural experiments. There can be many different behaviours, but here is an example of some. Maybe you have a son who is really old enough to look after himself, but when he goes out, you insist that he calls you every hour. The belief driving this is that something terrible is going to happen to him. The experiment is to give him more freedom. Maybe he could just text you once to let you know what time he will be home. Once he has come home safely a few times, without constant phone calls, you will find that you worry less. Here's another example. You're avoiding going to a party. This is driven by the belief that you will not fit in. The experiment would be to go to the party and just be yourself. Don't make any special effort to try and fit in or impress people. Just let people take you as you are. Maybe you check your wife's phone constantly. This is usually driven by a lack of self-confidence. You believe that your wife will find someone better and leave you. Stop checking, and after a month or so, note how you feel, but also note any improvements in your relationship. When you try to do behavioural experiments, they will feel uncomfortable and invoke anxiety. But they are a very powerful tool for reducing anxiety because they destroy the beliefs that are driving them. And because you have high function anxiety, you know you have the capacity to push through your anxiety, which means the chances of success are very good. For more videos about how to beat anxiety, visit my playlists. I have playlists for generalized anxiety disorder, health anxiety, OCD, social anxiety disorder, and panic disorder. Take care now.